If your doctor just prescribed Victoza, you might have some questions about what it does and how the treatment works. Victoza is a GLP-1 injectable medication used to treat type 2 diabetes by helping your body release its own insulin. They also reduce food cravings by sending signals to your brain that indicate you are full. Because of this, patients taking GLP-1 medications may sometimes lose weight. These medications can also protect against heart attack and strokes. Because of how it works, some people experience side effects like nausea, so your doctor may start you at a lower dosage and increase it gradually. Along with a healthy diet and exercise, GLP-1 medications may be very effective to patients with diabetes, especially those struggling to lose weight or have heart issues. Let's go through how to do the injection. Victoza is a once-daily injection. The injection pen should be stored in the refrigerator, but never frozen. If refrigeration is not possible for any reason, the pen can be kept at room temperature for up to 30 days or 1 month. When you're ready to do the injection, take the pen out of the fridge and remove the cap. Next, attach a needle to the top of the pen. Be sure to use a new needle for each injection. Tear away the protective paper tab, then twist the needle onto the pen. Remove the outer and then the inner safety caps. If you're using a new Victoza pen for the first time, turn the dial at the base of the pen to the flow line and do a test shot in the air. Check to make sure a drop appears at the tip of the needle. Next, select your dose by turning the dial at the base of the pen. Most patients start out with the lowest 0.6 milligram daily dose to prevent side effects. Your doctor may increase your dosage gradually every week. Now, insert the needle into the skin of your belly or thigh. Make sure to choose a different injection site every time. Press and hold the button until the dose counter reaches 0 milligrams. Slowly count to 6 and then remove the needle from your skin. After the injection, carefully recap the needle with the outer safety cap. Twist it off the pen and dispose of the used needle in a sharps container, not directly in your trash or recycling. That's it. If you miss a dose, resume once daily dosing with the next scheduled dose. Do not double up or take extra. After 30 days, dispose of your Victoza pen in a sharps container, even if there's still some medication left in the pen, and start using a new one. If you have any additional questions about how to use your injection pen, ask your doctor before you take your next dose.